So you had your testosterone levels checked for what seemed like a slam dunk low testosterone case, and yet your testosterone levels came back normal. Here are some things that may mimic low testosterone, but actually are not. This is something I see pretty often. Guy comes in, very obvious low testosterone symptoms, libido, anxiety, poor sleep, all of them. We check their levels and they're actually normal. This is also analogous to folks who have low testosterone. We fix it on paper. It looks great. Nothing's wrong. They don't feel any better. So here is what I go through in my mind to try to figure out, all right, what else is kind of clouding this picture here? So number one of the most common ones is going to be sleep apnea. If you have sleep apnea, you are going to have most of the same symptoms, and it's also going to cause low testosterone. So for somebody where I bring their testosterone up and they don't feel better, they may have sleep apnea. So we get the testosterone level to a healthy spot, not too high, and yet their blood cell counts shoot through the roof. This is usually a dead giveaway that you have something that is also enhancing that effect, and that is the chronic low oxygen state of sleep apnea that's not treated. Burnout and depression. These are two different animals, but I'm going to say them together because they're kind of similar. This is going to make you frustrated, lack of enjoyment in things. Burnout symptoms mirror the Adam questionnaire in a lot of cases, decreased enjoyment of life and all that kind of stuff. So in those cases, unfortunately, there's no clinical test, no serum blood test we can do for depression or burnout, which is why in these cases, if your levels look good, this is where a skilled clinician will start asking you about other things that may be either contributing to mood issues and pinpoint it that way. Unfortunately, some of the treatments for depression may actually worsen the main symptoms of low testosterone, like erectile issues and libido issues. It's a fine line to walk. But treating depression will also make you feel better. And it's obviously important to having an otherwise good quality of life. The depression-like symptoms of low testosterone, it's less about the sadness and more about the general blah feeling. But in men, depression often presents very similarly too. There certainly is, of course, the textbook can't get out of bed, things you see in movies and on TV. But a lot of times men with depression end up being just very surly and just decreased enjoyment of life. Alcohol use. This is kind of a cheating one because it also does worsen your testosterone levels too. If you're drinking frequently enough, this is more a case where you may have low testosterone, we bring it up, and you still don't feel better. That's because your sleep is disrupted by alcohol. Alcohol is terrible for sleep quality because alcohol also really worsens your mood, and it's going to impact libido and blood vessel health. It's going to affect your erections too. So in the end, cut back on drinking. Those damn scientists keep finding more and more reasons why it's bad for you. This list is not exhaustive. It's just some of the most common ones that I see. Even things like overtraining can actually mirror low testosterone symptoms too. Propensity for injuries, poor recovery, kind of burnout type symptoms anyway, loss of enjoyment of exercise if that was your kind of main thing. And one last one that we don't really test too much is going to be low growth hormone levels. In these cases, it's typically less of a textbook diagnosis where someone's going to leap to that and just test your levels. However, if you are chronically affecting your sleep, either because of short sleep or alcohol use, you may have relatively low growth hormone levels or decreased activity, and that's going to affect your recovery, aches and pains, may you just feel kind of inflamed, and that certainly can look like low testosterone as well. Now, it's kind of cheating, but low estrogen also kind of looks like low testosterone because low testosterone symptoms a lot of times are low estrogen symptoms. I did have a guy today actually who had normal testosterone, but most of these sexual symptoms of low testosterone, it's because his estrogen was undetectably low. These are tougher to treat because we don't really give estrogen to men for therapeutic purposes in this case. So what you often got to do is figure out how you can facilitate the conversion of testosterone to estrogen, which is usually the opposite of what you're trying to do. But in these cases, it is a real thing and does exist. That's one more difficult strategy to have and essentially do the opposite of what you try and normally do. So instead of splitting up testosterone doses, you might give them, larger ones less frequently and that kind of stuff. It's where the trial and error, art and science mix of medicine kind of comes in. But if we can get it right, obviously you'll feel better because low estrogen is going to make you feel a lot of the same symptoms as low testosterone in general.